and welcome back to When IT Hits the Fan, brought to you by Rhyno Healthcare Solutions. I'm Christian Patillo. Today we have Michael Elley with us. Thank you so much for taking time.
Great to be here. Thank you for having me.
Yes, and so as always, the first question is, who are you and what do you do? How'd you get here?
Yeah. My name is Michael Elley. I'm the CIO for Baptist Health. We're a 12 hospital system, about a $2 billion organization based out of Little Rock, Arkansas, spanning the entire state, largest healthcare provider within the state of Arkansas. I've been in healthcare since 2004, 2005, about 6 different healthcare systems, passion of mine. And so that's who I am and how I got here.
Absolutely. And what first drew you to this field?
My wife is a RN, and so we would spend time with other clinicians. And I was in kind of government finance prior to this, and I was like, let me try this healthcare thing out. And I got my first job at BJC Healthcare, based out of St. Louis, so kind of in a IT operational role. And it was no looking back. I fell in love with healthcare. It was took a while to get into the industry, in terms of understanding how different it was than government and finance. But again, no looking back.
And from all the different positions you've been in, be they in the healthcare industry or prior in other industries, what are some lessons that you've learned when it comes to helming IT and best practices when it comes to that?
Yeah, I think it's really understanding operations. And so as a leader within technology and the digital space, you really got to step out of you got to step out of the core IT function and really understand the business. So in healthcare, again, I got an early start working in between our different chief executive officer, chief financial officers of the hospitals and then within IT, and doing so really gave me a solid understanding and look at just how hospitals and clinics and revenue cycle and all of that operate. And so really just really stepping out of that kind of traditional IT role, understanding the business, and then you can apply your technology background to that.
May I press in on that just a little bit, just for members in the audience who maybe haven't had the experience that you had? What are some of the lessons that have come out of that?
Yeah, I think it's some of the lessons. It's spanned 20 years. There's a lot of lessons, right? But I think part of it is really just shutting up and listening at times. And so listening to our clinicians, our clinician leaders on the physician, nursing, ancillary sides, understanding their needs, their gaps, where do they really need us to intervene and help support them. And that's a lot of it. But I think there's also the part of it that's part of the listening part, but there's also the part of, you really got to drive towards innovation. And so there's all sorts of new technology that's always coming out, and not everybody's always staying on top of that, right? And so really having your finger on the pulse of what's going on within the industry, from an innovation, digital, whatever perspective, and bringing that to the forefront to your user base is really key.
Absolutely. And when it comes to aligning IT initiatives with the broader goals of hospitals, especially as healthcare evolves, do you have any wisdom about balancing sometimes it takes a while to stand things up in healthcare IT specifically, too. How can we balance being on the cutting edge with also finances and also the speed that it takes to get things stood up by the time it's up? Sometimes it's already time to move on to the next thing. How do you find the proper balance between modernity and, let's say, posterity?
Yeah, I think earlier in my career, we were doing a lot of 5-year, even 10-year strategic planning. And I haven't done that for a long time because things are evolving so much. And a lot of our strategic plans, even within the healthcare system, are kind of 1-year strategic plans. And this is what we really want to focus on this next, 12 to 18 months. And so we align our IT goals, our IT initiatives to those. That really leads our structure of what we're focused on for the year. And so that's a great guidance. But there's also that carve out of just that they call it the KTLO, that keep the lights on stuff, right? That's not aligned to all of the strategic initiatives of the organization. And really it's just an education of key leaders around, hey, there's still this bolus of work that's probably 60%, 70% of things that are going on within the organization, IT organization, that you don't even know about, right? That from a cybersecurity, from a server, networking, telephony, all that perspective. And so it's a continual kind of visibility into that world for your key leaders throughout the organization, so they understand that you have all that's going on, and but you're still able to carve out the right amount of resources to focus on those strategic initiatives.
Absolutely. And as the tech field changes under our feet every single day, what would you say here in 2025? What are some of the biggest challenges that healthcare IT leaders are facing just across the board? Um,
Yeah, it's been interesting since really since COVID. It feels like there's been just an onslaught of new solutions vendors that are hitting the open market and coming out with capabilities. Of course, everybody is really focused on digital, and AI is the key buzzword
yes.
that's out there right now. And so really just trying to stick with your core solutions, right? For us, it's Epic and our ERP vendor, which is Infor, and we're big Google partners, and really focusing on those. But then while we're going out and evaluating these other kind of point solutions within the markets, is key. But there's so much coming out there, so that's very difficult. Obviously, the cybersecurity world is keeping, what's the one thing I
Be
keep
on their
in mind
toes.
is the cybersecurity world that's everybody is focused on, and year over year investing more in terms of not only resource capital but financial dollars to help ensure that we're more secure. And so those are really a lot of those items there.
Yes, and digging into something that you just said, when it comes to cutting through the noise of all the solutions that are cropping up faster than you can cut the heads of the Hydra, what do you look at in order to try to cut through all of the smoke and see which are the best ones to begin investing in?
Hey, can you ask that again? I'm sorry.
Absolutely. I apologize. When it comes to all the solutions, just like you said, so much tech is coming out so quickly. How do you select what is right to invest in?
Yeah. So first, a lot of organizations, and we're no different. We're looking internally first. So what do our core vendors have? Can they meet that need? Do they have that capability? If they do not, then we're evaluating the markets. What are others doing? What are other organizations that we think are maybe a little more cutting edge, and what kind of technology are they deploying? And so then we'll go have conversations with those vendors and pull them in, understand their value prop as well. But yeah, we always want to try to start internal and then look at who else is really catching steam within the market, and then we'll evaluate them.
Absolutely. And I always make it a rule on the podcast. I don't say AI first. I let the guests do it. And so now that that bell's been rung, we can dance there just a little while. It's, at least for me, it is almost impossible to completely predict where AI is going. But from your perspective, if you could maybe look into the crystal ball for the next 3 to 5 years, what could be some of the most helpful things that AI could bring to the healthcare space
Yeah,
if
I'd say
everything goes right, you know?
yeah, it's difficult, and it's funny you don't bring up AI first, and I was just at the HIMSS conference this past week, and everybody's touting their AI, but I think there's a little bit of a misnomer out there. There is definitely AI capabilities out there within the vendor space, but a lot of this stuff is actually RPA bots, those sort of things that are just being touted under AI. And so back to your earlier question of weeding that out, that's something that's, kind of, you always have to really evaluate. But yeah, I mean, how we're evaluating is looking at really, in, I guess, four areas. So how can we benefit our clinicians, right? And so our physicians, our nurses, ancillary, with leveraging these capabilities, new advanced capabilities in the AI world, to make them more efficient. How do we improve the efficiency of our back office? So people like myself, or within finance, rev cycle, how are we impacting them? Rev cycle itself, how are we interacting with the payers, leveraging AI? It's kind of AI working back and forth between the payer side and the hospital side. And then we're also looking at how do we build some of our own capabilities with some newer market entrants as well, to really, how do we automate our manual tasks that we have within our end user base? What can we take those manual tasks off of people's plates? And so that's a lot right now. I think cybersecurity is also going to be currently is and will continue to be a growth area within AI. It'll really be AI on the cyber side of people like our organization, and the threat actors as well, AI fighting each other. But those are kind of five areas, I guess, I see that AI moving into.
Absolutely. And I might dig into all five of those as we move forward. But let's start at cybersecurity.
Sure.
For the people at home, can you help kind of paint the picture about how different cybersecurity looks now in 2025 than it did, let's say, in 2019, a year that I'm picking very much on purpose? So if you could say a little bit more about how the landscape has changed, especially now that AI has become so prevalent and so in everybody's hands. Can you tell us a little bit more about the threats and dangers, and then maybe go into how we're combating it?
Yeah, I'd say there's one area within our organization that has achieved the largest increase in funding and resources. It is definitely within our cybersecurity space. We work with a outside company every year to come in and really assess our posture around cyber. And from that, we build 3-year roadmaps that we want to get better with when it comes to cyber. And so, for us, it's definitely there's more resources that are focused on it day to day. There's more technology that's in place, and really a tremendous focus in the end user education around this. So, back in 2019, you may do one phishing exercise and one training a year, but now it's extremely common, and you're starting to see the education and training to our end users be different based on if you're kind of a general user on a, it's somebody on a nursing unit that won't be interacting much with email versus your executives, right? And so who are be targeted more. I think into the future, we're going to see more deep fakes, whether that be video, audio, things like that, trying to either gain access or have money sent to places. And so that's more education, more technology to help combat against that. So it's just it's something that is ever evolving year over year in terms of what we're focused on. One of the things that I have noticed that's been of interest within the cyber world, and this is an issue we had kind of within our application space back in the 2000s, was we had a point solution for everything. And then everybody started honing in and, hey, we're going to deploy Epic across the organization. That's going to, do most of what all of these, 15 other systems can do. We're seeing that same thing on the cyber space. Now we have, 10 to 12 different solutions out there. And I think something in the future that is going to start to occur is kind of a rationalization of your cybersecurity technology and vendors as well to kind of simplify that across the enterprise.
Absolutely. And as CIO of a provider, both payers and providers have to work with cybersecurity because they're both dealing with HIPAA protected data, but you're dealing on the front lines with the clinicians themselves. I'm wondering, for AI and automation, I hear again and again about physician burnout and also just the lack of bodies going into medicine right now. Can you enlighten us a little bit about anything that you predict AI-wise or automation-wise that might help take the burden off of our burned-out healthcare providers?
Yeah, there's a lot, and that's really a lot of the exciting stuff is. So obviously, ambient documentation is caught on like wildfire, and so there's a ton of vendors out there providing those capabilities, and organizations that are deploying it thousandfold across their organization. And so I think that's going to continue to be going to be one. Again, those things that can be automated within the EMR for clinicians is going to be something else that is going to help reduce that burnout and improve resiliency. I'll tell you one thing that we're really interested in and focused on is we're really facing, not just within our organization, our state, but throughout the country, a real, we're calling it a crisis as it pertains to radiology. You're seeing a lot of organizations, hospitals lose their radiologists, and radiology coverage start to back off or decrease. And so there's a really heightened sense of awareness of how do we leverage AI to improve the efficiencies of our radiologists, imaging, those sort of things. I think that's going to be kind of the next evolution around this to really help organizations and become more efficient in that space.
Absolutely. And next topic is a little more divisive. I haven't heard a single provider say that there isn't clinician burnout. That has been a 100% agreed thing that I've heard echoed again and again when I interview people. For some, I hear that there's also a lack of, let's say, body or education going into IT itself, that they can have problems sourcing the correct talent for the correct positions. Is that something you're seeing, or is it more that your positions are filling just fine? I've heard both sides.
Within IT?
Yeah.
Yeah, I think our positions, we are not having a difficult time. We have really low turnover.
Excellent.
Yeah, we're not having a difficult time. Obviously, we're like a lot of organizations, and we now have a remote policy in terms of how we're staffing, folks. So we have staff that live all across the country. We have a hybrid model for, work at home and some on site, and it's really dependent upon their role. And so it's been very beneficial. I know there are others that are facing it, that are outsourcing some of their staff. We attempted to do a little bit of that. It didn't work the best, and so we brought it back in. And we find that our staff that and our team that is really employed by us really buy into the culture, the mission, and can really drive the most value for the organization.
Absolutely. And that's excellent to hear. And when it comes to patient outcomes now, when it comes to servicing the patient as well as preventative medicine, do you think that AI automation or just tech in general has a path forward in that? Maybe the prediction of the next 3 to 5 years?
I do. I think our patients will be able to leverage this type of technology to better direct them to what type of care they can receive to help them. We joke about WebMD now. Every patient can almost be as knowledgeable as a physician. And I'm joking, but it's the same thing. I mean, all this information is out there for our patients to become more knowledgeable. What I think will be interesting, though, is how does this technology make it easier for our patients and our consumers to find care that may not be in their backyard, meaning so they can leverage care. I live in one state, and I can go and identify a provider or a system that can really meet the needs of me today, whereas maybe my current system cannot. And so I think it's going to be more of a consumer driven environment with these technologies.
Absolutely. Going back, or no, actually, let's go on to compliance.
Let's not. No.
I know that's exactly. And the question is, regulatory compliance, while
Right.
important, can sometimes feel more like a burden than a benefit, or at least perhaps for those implementing it. Can you talk a little bit about what it's like to be CIO of such a heavily regulated industry and how to stay up to date with the needs that do protect patients, of course, but do make our jobs a little bit difficult?
Yeah, and they're important. Patient privacy, patient data, their data, the safety of that, integrity of that data is very important. And so it comes with doing the job. And so you have dedicated people within organizations such as ours that are almost solely focused on that, ensuring that we are meeting those regulatory requirements. I think the biggest issue that we may face from those is it can stifle innovation, because there's certain things that we have to do, and a lot of those things are right to do. But because of those things, we may at times have to kind of hold back some of the innovation that we may want to do as a healthcare provider.
Absolutely. And now moving a little bit more into leadership and what you've learned there, how does one help so many different teams and lead them through all of their projects? I know there are so many people that report up to you, but between the multiple hospitals and just the demands of a CI role or a CIO role in general, even without having multiple tentacles on the octopus, how do you keep communication open between so many people? How do you keep projects moving forward and keep goals aligned?
Yeah, I think there's a couple of ways that we look at that. One, I mentioned kind of my start in healthcare is kind of that mixture of operations and IT, and so a lot of our leadership team sits within different operational teams, whether it be on our hospital sides, it sits on their leadership groups or our clinics, or we have consortiums that focus on things such as radiology, lab, surgery, and those sort of things. And so we make sure that we are plugged into those areas, so we know what's going on, what their initiatives are, what their gaps are. So that's one. We have obviously our standing meetings that is leadership driven, but I do a lot of bringing in kind of those individuals below the management ranks to make sure that they're not only are we informing them, but for more often they're informing us what's going on within the business. And so there's a lot of value there, and we really value their leadership and their input into these things. And so it's communication. And I know it's overstated, but communication within teams and across teams is so important to ensure your success.
Absolutely. From having not only being a success yourself, but seeing so many people and seeing so many different teams, what are some of the traits that the people who last the longest, who have the most career success in IT, what are some of the traits or actions that you find are repeated multiple times through?
Yeah, I think, I know when I went to different places, and a lot of times the people ask me, what are you looking from me? And I'm like, own your book of business. And so really that ownership of, hey, this is either the team you're on or the team you're leading. This is how you're impacting the organization by focused on, lab or whatever right here. Go own that. Help drive the business to be more successful, to be more efficient, support your teams, care for your teams, all of that sort of stuff. And so I think that the people that have the ownership in terms of themselves or success and where they work and who they work with, that is what I find to be the most contributed to those successes.
Absolutely. And now it's time for my favorite question every time that I do these interviews.
Okay.
If you had a bottle and you could put a piece of information inside and send it back to yourself at the beginning of your career, what advice do you know now that would have served you well back then?
What advice do I know now? Well, besides all the investment advice I would have gave myself, right?
Yes, the lottery
And
numbers.
yes, a
Yes,
lot of numbers, and
absolutely.
buy
And
all
it's
the
not,
buy all the masks before COVID hits.
yes,
Really, I think I learned this later, kind of mid time of my career, was you can't do it all yourself, and so really to be reliant upon your team. And I'm not a micromanager at all, and but to really rely on them to say, hey, let's lay out the direction, let's lay out where we want to get as a team, department, organization, what have you. But you just can't do it all yourself, and so I'm really trusting those individuals to own that. Again, that ownership is something that I probably picked up more middle of my career.
absolutely. And so thank you. You've been so incredibly generous with the lessons that you've learned. And I just want to thank the people at home as well for listening to another episode of When IT Hits the Fan.